and welcome to this COVID-19 update, keeping you connected here on the Bass Coast, presented by Bass Coast Health and sponsored by Wonthaggi Miners Dispensary. In today's update, we celebrate International Nurses Day, May the 12th, which is the birth date of Florence Nightingale. And here's our very own Florence Nightingale to help celebrate. Louise Sparkes, Chief Operating Officer from Bass Coast Health. Hello, Louise.
Hi, Kevin. How are you?
Good. Nice to have you back.
Thank you.
So, Louise, if ever there was a year to acknowledge the incredible work nurses do, it is this one. How are nurses at Bass Coast Health celebrating International Nurses Day?
So this year, because it is a bit of a different year with COVID, Kevin, we're doing something a little bit different to previous years. So our kitchen made some wonderful cupcakes for all our nurses and midwives, and we celebrated International Day of the Midwife last Tuesday. And they all got a little cupcake to have at their break. And for some of our nurses at Wonthaggi, we've also provided them with a coffee. And so it's just a little token to say thank you to the wonderful work that they do for us and our community.
How many full and part-time nurses are employed at Bass Coast Health?
So we have 40 midwives that work across our midwifery area and into our maternal child health nursing program. And we have about 380 nurses. So in total, just under 400 nurses and midwives at Bass Coast Health.
That's a lot of cupcakes.
It is a lot of cupcakes. We've got a wonderful kitchen.
Right, that's great. That's fantastic. Hey, listen, has the dreadful consequences of COVID-19 worldwide and around the globe changed the way nurses have gone about their daily tasks this year?
I think so, in many ways, because COVID is such a new disease that we're trying to understand and has changed even in the last sort of few months that we've been dealing with it in Australia. They've had to change the way they do things. But I think nurses and midwives are also very used to dealing with people with infections and understanding how to protect themselves, stop the spread of infection and protect the patient. So although we've had to stop and do things slightly differently, I think their actual practice has been the same. Probably what's been quite different for them is the changes we've made to the hospital and the way we've done things as a whole hospital rather than just individual care needs.
And I suppose there'll be a lot of things that would be up until now only in theory rather than having to put things into practice. And you've got to that stage where you've had to put PPE into practice and you've had to take extra precautions outside the hospital, as we've heard on the updates. Things are a whole lot different at Bass Coast Health. Absolutely.
So even the way that the nurses and midwives come into work is different. We've done a whole lot of simulation training across every part of the health service in whole of health service teams rather than just individual teams around how we would manage anybody who was COVID positive. And we're still yet to have a COVID positive patient. So we're absolutely ready if we do have one. But I think that's been something that we haven't probably done. We don't normally do where we bring other teams together. So it's been a fantastic opportunity for the staff. And I think the other thing for the nurses and midwives is they're seeing what's happening overseas. And initially, probably that was a little bit scary. But
yeah, confronting for everybody. Really.
Absolutely. But I think we've done a great job in Australia with what we've done in trying to manage to miss a surge. And I think we're well placed to manage whatever comes our way in regard to COVID up until we have a situation where we have a vaccine.
That's great. How has the community shown their appreciation for Bass Coast Health staff, nurses included, of course, over the period of the past months?
I think we've absolutely seen support from our community, which has been fantastic for the staff. So we've had all those wonderful donations of food. We've had, Easter eggs, hot cross buns. We've had scrubs. We've had masks. We've had so many things where the community's got behind us. And I think even just generally when people come into the hospital, the feedback we've been given has been fantastic. And that's really, really important for the staff who, are doing something that is a little bit different and can be a little bit scary. I think it's wonderful to know that the community are behind you and supporting you as well.
So how long have you been a nurse?
I started my nursing training in 1989, straight from school, and became registered in 1992, so a long time.
Yes, it is a long time. What's the most satisfying part?
I think you can make a real difference to people just from little things that you do. So you have this enormous opportunity to spend, the worst and the best days of people's lives with them, and I think from that you can make a difference. And it's something that often you'll remember. I think you get a lot out of being a nurse personally. It develops you as a person. And I think you get to be there, and that's a privilege for all of us at the end of life and at the beginning of life.
So because there's been so much focus on frontline health workers, medical workers, this may have inspired a lot of young men and women to become nurses. What are the first steps to make that a reality?
So, anybody can become a nurse. If you haven't done Year 12, don't let that stop you. There's lots of pathways into university and TAFE now. So, those things you can easily find out about by ringing a university or TAFE or going online. And it might take you a little bit longer to get into the course, but I think the most important thing about a nurse is your personal characteristics. It'll hold you in good stead to do well. I don't think you have to be particularly smart. I think you have to like people and be willing to work hard, and I think if you want to do it, you'll succeed and you'll get there. And we run some really good programs at Bass Coast Health to try and build up our nursing workforce, and also to have jobs for the community as well. So we've just introduced paid student nurses as part of the COVID response. As a new thing we're trying, this is a new thing that they've tried across Victoria, where we actually get them to do some of the basic care, second and third year nurses. We've got 5 we've just employed, and they'll be able to be paid to practice some of their skills and get through their training, and we're hoping then they'll become graduate nurses with us and then stay for their transition year and then stay employed with us throughout their career.
So there's been some positive things come out of the COVID-19 part of 2020, which has taken up most of the year. Thank you for joining us again today, Chief Operating Officer from Bass Coast Health. Congratulations on your achievements and everybody's achievements, most importantly the nurses celebrating International Nurses Day. Thanks, Louise.
Thank you, and happy Nurses Day to all our nurses, and happy International Midwives Day to all our midwives. Thank you.
Fantastic. All right, there it is, another COVID-19 update. We'll have more for you, and until I see you again, take care.